Rural hospitals are community strongholds, serving as the key point of care for nearly 20% of Americans. Beyond providing healing and hope, rural hospitals nationwide are pillars of their local economies, creating essential jobs that support families and community vitality. The emergence of COVID-19 has created unprecedented challenges for the U.S. hospital system. As frontline responders, hospitals have significant responsibilities for identifying and treating patients with COVID-19. Hospitals around the country are adapting to the constantly changing face of the COVID-19 pandemic by adopting both expected and innovative strategies to tackle the crisis. Welcome to Advancing Health, a podcast brought to you by the American Hospital Association. I'm Tom Hitterly, senior writer for AHA. AHA has compiled several case examples demonstrating the struggles and successes of rural hospitals battling COVID-19 in their communities. These have been organized in a compendium available on our website at www.aha.org. For this podcast, we honor our hospital heroes and examine how two rural hospitals are living and learning through COVID-19. Today, we meet with Dr. Leslie Ogden, CEO of Samaritan North Lincoln Hospital and Samaritan Pacific Communities Hospital, both located in Lincoln County, Oregon.
Good day. I'm John Supplett, Senior Director of Rural Health Services for the American Hospital Association. Today, we'll hear the story of a frontline rural health system caring for COVID-19 patients. Dr. Leslie Ogden is CEO of two critical access hospitals located in Lincoln County, Oregon, on the Pacific Coast. Samaritan North Lincoln Hospital has 16 beds, and Samaritan Pacific Communities Hospitals has 25 beds, and both are part of Samaritan Health Services. Dr. Ogden, it's been a stressful 7 months as your community battles against COVID-19. There's much that you've learned from your experience and much that you can share with our rural hospital colleagues. Thanks for taking time to share your story with us.
You're welcome, John. I'm pleased to share our story and hope others can benefit from our experience.
Dr. Ogden, the first confirmed case related to the COVID-19 pandemic in the United States was announced by the state of Washington on January 21st. A little more than a month later, on February 28th, the Oregon Health Authority reported the first case of suspected coronavirus in a resident of Washington County near Portland and a little more than 100 miles away from Lincoln County. What was your reaction when you heard the news last winter?
John, I think we were a bit naive. We had hoped that we would not see the virus in our neck of the woods in a rural area. So we were cautiously optimistic that this was a disease that would be confined somewhere else. However, as the pandemic progressed, we saw quite realistically that we needed to jump in, pay attention to our emergency preparedness plans, to our surge plans, to our testing facilities, and really ramp up our personal protective equipment, our PPE. So lots of things became very obvious as the pandemic became more and more real for us the closer it got.
Well, and you seem to manage very well for months. And then on June 4th, Lincoln County recorded an outbreak of COVID-19. What happened?
Well, initially, we saw very slow case growth. That was prior to Memorial Day weekend. We had only really experienced 10 cases, and that was in a population of our county of about 50,000 people. So these were all friends and family. The contact tracers were easily able to verify how each of the patients contracted the virus. But in early June, that all changed. So Memorial Day weekend parties happened. We had increased community spread, and then we experienced our first workplace outbreak at a fish processing plant. That started with about 5 cases and quickly exploded to a peak of 122 cases in one day. So very quickly, we found ourselves at the center of a COVID-19 hotspot.
And that really seems overwhelming to have that occur so quickly. With the confirmation of these cases in your area, what were your next steps?
Well, initially, our Lincoln County Public Health Department sent out an emergent request for additional bilingual workers. They needed people who could be quickly trained as contact tracers, given the hundreds of new cases flooding in. We were able within Samaritan to identify 2 employees that we loaned to public health, and as did the community college and our local tribe, the Siletz tribe. So with all of us pulling together, we were able to quickly provide the manpower for public health to rein in the outbreak. Then we also had to look at our own clinical teams, and at that time we began caring for our first inpatient cases of COVID-19 in our coastal hospitals. So this was a culmination of months of new policies and procedures concerning that patient safety and care that we had just newly implemented. We had subsequent training. We had to run through the paces. So that ensured that there would be no spread of the virus within our facilities. And then shortly thereafter, we all shared the tragedy of our first patient death related to the outbreak as well.
And I'm sure that had to hit you and your community very hard. You've put a lot of time and resources and efforts going into this preparation for managing the pandemic. And then you've got the experience of working with those that are ill in your institution and who are hospitalized. Dr. Ogden, what's been the biggest obstacle to your effort to care for patients during this pandemic?
Well, it's sort of multifactorial. Of course, as you know, John, rural hospitals always seem to be at the end of the supply chain for personal protective equipment, for testing equipment, for supplies. We had to develop new sources or substitutes for all of these items to continue to provide that safe environment for our employees and to continue to increase our testing volumes and decrease our turnaround times. So while we had that initial problem sourcing and purchasing necessary volumes of nasopharyngeal swabs, of M4 viral transport media, of test kits, we did see some improvement in those areas, but we still have intermittent problems with test turnaround times with our contracted labs. We've incurred significant courier costs to get tests to and from our urban centers where testing equipment's located. We've become very resourceful at building new relationships and finding new suppliers to meet our needs. And as you know, again, staffing is on any given day can be challenging, but it's especially so during a COVID-19 outbreak. So we've hired new positions, we've shared staff across our hospitals, and we just do whatever we need to do to meet those growing needs.
So Dr. Ogden, when I listen to your story, it sounds like you've been very resourceful and used a lot of ingenuity working with local groups to manufacture your own masks and provide for your own face shields and really try to work to overcome these obstacles that have been plaguing a number of our colleagues as well. Share with us, though, as your experience grew through managing this pandemic, what's been the biggest surprise to your effort to care for patients during this period?
So I think our biggest surprise was that we discovered something about our community. As we progressed through the outbreak, we discovered that over half of those testing positive were Latino. And we found ourselves at a disadvantage because we were not really meeting the needs of that Latino COVID-19 community and those patients. And those included both Spanish-only speakers as well as indigenous Guatemalans who migrated to the area. They carried their traditions and a verbal-only dialect to our community. And we saw quite readily that we needed to change up our direction and respond to them in a much better fashion.
So what was that response? How did you respond to this discovery?
Well, we quickly joined forces with the Lincoln County Public Health, our county commissioners, an organization named Centro de Ayuda, which is a center for cultural awareness, education, service referrals, and language support. We needed to join forces with them to understand the disparities in care and to fill those gaps. So we developed some biweekly meetings with these stakeholders, and community members became a part of that. And in these meetings, we were able to review and discuss disparities in access and how they could be eliminated. And we've also prioritized improvements in cultural competency and improved access to care for non-English speaking residents.
So you've really been through a tremendous amount during the experiences that you've had. And right now we're really speaking through this June 4th surge that took you through June and part of July. How is the team at Samaritan Health Services faring? That is, how is their physical, mental, and emotional well-being?
Well, as you can imagine, it takes its toll. Our positive tests have declined or stabilized. Our admissions have dropped to a trickle. But even though the pace has slowed, the staff members, find themselves stressed. And so we have mobilized our wellness council. We've stepped up our employee assistance program. We've designed a wide array of options, such as a mindfulness app, a virtual yoga class, and employee assistance hotline, just to name a few. And we allow employees to pick any or all of these offerings, whatever they feel will help them.
So through this experience then, Dr. Ogden, you've really had to make a number of changes in the operations of Samaritan Health Services in Lincoln County. Can you tell us the kind of impact that COVID-19 is having on the hospital's business and how you're managing these changes in volumes and lost revenue?
Absolutely. This is of primary importance to us continuing to serve the community. So initially in the outbreak, we saw our ER and our inpatient volumes go very low, very different than typically our seasonal surge. So this came from those patients who were reluctant to seek care during those early days of the pandemic. We had to completely shut down elective procedures and clinic visits for all patients, and that ran during late March and all the way through April, and we weren't able to restart any of those services until May. This was in order to make sure we were ready for any COVID surge, but that really never materialized. So we slowly ramped back up in May. In June, we were able to care for both COVID patients as well as all the other patients who were seeking non-COVID health care. And we managed to balance both needs without overwhelming our medical resources. So we were very lucky. However, when you go back and you look at that time of shutdown, what you find is we had a loss of the majority of our revenue sources, and we ultimately lost millions of dollars during that time. Luckily, though, we were able to received federal CARES Act funding. We applied for and received emergency funding through grant programs. We had accelerated and advanced payments, as well as rural healthcare specific programs. So when you combine all of that into a patchwork of funding, we were able to sustain our operations until we resumed everything at that 100% around June. And of course, we hope that both state and federal governments will continue to see how at risk our rural healthcare programs across our nation truly are, and will continue to fund sustainability programs because this pandemic continues.
Well, and we very much share that concern and are working to make sure that we're getting the resources from the federal government that's necessary in order to keep an access point to care across our rural communities. I can't emphasize this enough for our listeners, Dr. Ogden, that you've been living this experience for 7 months. Where do you see this crisis heading? Do you think there's an end in sight?
Well, we presently continue to treat new COVID patients. Even though we're not in the midst of an outbreak, they are still there. We did have a small outbreak August 4th at an assisted living facility. That resulted in 14 positive cases. We had another hospitalization associated with that outbreak. And we had a total of major workplace outbreaks, up to 3 now, with a number of minor outbreaks as well. So knowing that Lincoln County is a tourist destination for many who reside in Portland and Salem and Eugene, as well as Washington and Idaho, and this summer's been busy despite even the COVID-19 pandemic. Knowing that our ER volumes are returning to normal, our seasonal busyness, we've resumed elective procedures. If another outbreak occurs, we could imagine a situation that we would have to shut down all services again, all those elective services, and concentrate on our emergency and inpatient services to deal with COVID-19 surge patients. So this is really our reality until the COVID-19 pandemic resolves, whenever that may be.
So Dr. Ogden, you have lived through a great deal over the past several months, managing multiple COVID-19 surges. Please tell our listeners what you've learned from this experience.
Well, we've learned a number of things. So the first thing is something along the lines of forewarned is forearmed. So when you think about that, it's really an emergency disaster plan for a medical surge before the pandemic arrives, before the COVID-19 patients arrive. Is really key. We collaborated with our county public health department and others to really develop a robust plan. We also had the supply chain issues that were persistent, especially with personal protective equipment. We saw this with PPE, with ventilators early on, with testing equipment and supplies, and we really needed to develop creative solutions to make everything work. We also, as we mentioned, found staffing issues to be of utmost importance. And we know that flexible staffing allows for better care and for a safer work environment. So we were able to flex staff between our 2 locations and even hire some additional staff to make it all work. We know that cultural awareness is a big part of leading us to cultural competency. And we have a diverse demographic, including Spanish-only speakers and indigenous Guatemalans And we have to take care of everyone equitably and to the best of our abilities. And I think one of the biggest things we've learned is you cannot go it alone. We have to rely on all of our partners, collaborating with Lincoln County Health Department, collaborating with our county commissioners and other very important community stakeholders, and with the support of the broader Samaritan Health Services system to really bring all of our resources to the table so we can beat this virus. Without these resources, we may not have been so fortunate.
Dr. Ogden, thank you very much for your time. I know how busy you are, how busy you have been. Thanks for sharing your story with us. It's a very important message that our colleagues are listening to and appreciate.
Thank you, John. You're very welcome.
The strength of rural healthcare is critical to the fabric of American healthcare, and it's our mission to safeguard it, improve it, expand it, and advance it for future generations. Thank you to our country's healthcare providers for their hard work, the dedication, and sacrifice in this trying time. And thank you to the hospital and health systems leaders like Dr. Leslie Ogden, CEO, and the nurses, physicians, and all the healthcare heroes caring for patients at Samaritan Health Services in Lincoln County, Oregon, and across rural America. This is one of several stories of how rural hospitals are rising to the challenge of COVID-19. Visit www.aha.org to access these and other COVID-19 resources available to hospitals and health systems. Thank you very much for listening. This is John Supplett. Have a great day.